This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on WHAR. I'm Kyle Wiggs. Our guest this morning is Dr. Peter Kochopura, and we're going to talk with Dr. Kochopura about lung cancer and the screenings that are available, prevention, and just that, preventing lung cancer and screening for it. But first of all, Doctor, good morning to you. Thanks for coming on the show.
Good morning, Kyle. Thank you for having me.
We appreciate your time. Let's talk about your background a little bit. Where are you from, and how long have you been in West Virginia with the Mon Health system?
I was born in India, and I grew up in New York City. I went to Regis High School in Manhattan and the City College of New York in Manhattan. And then for med school, I went to New York Medical College in Westchester. I did my residency in Stony Brook in Long Island. So I did everything in New York up until fellowship. I came to Pittsburgh in 2004 to do my fellowship at UPMC. I spent 18 years with UPMC between training and being an attending physician in pulmonary and critical care. And then I spent 3 years with WVU Medicine. And this is my second year with Mon Health. Okay.
So you grew up in an urban environment, the biggest in the world, also Long Island and Pittsburgh, more kind of urban environments there. How has it been for you? It's been a few years now, but how has it been for you adjusting to a more rural existence here in the state of West Virginia?
It's been great. Actually, I really appreciate Mon Health. I believe in community-based medicine, and even through my years at WVU and at UPMC, I always practiced community-based medicine. And so the setting may be different, but in principle, it's the same. Mon Health's mission is to provide outstanding community-based care, and my mission is to provide community-based pulmonary and critical care. And so I practice in Preston County in Kingwood, Lewis County at Stonewall Jackson Memorial in Weston, and here in Morgantown. I really value being able to go to those communities and meet patients where they are because I'm a big believer in community-based care.
Pulmonary care, that's your expertise. What drew you to that?
Well, it's interesting. So I trained in pulmonary and critical care medicine together, which is commonly the case in the United States. Most training programs combine ICU and pulmonary. I really loved working in the ICU when I was coming out of training, and pulmonary was a part of ICU. So when you weren't training in the ICU, you were doing pulmonary medicine. I really came to appreciate taking care of patients with lung disease as my career progressed, because a lot of times you would see somebody in the ICU and then you'd follow them in the pulmonary clinic, and so you develop relationships with patients, and so the two really kind of went together. So I really enjoyed the in-hospital side, but I also came to really enjoy the clinic outpatient side with pulmonary.
Mm-hmm. We are with Dr. Peter Kochopura, and his expertise is pulmonary and critical care, a little bit of a combination there. We're here to talk lung cancer, sir. So give us an overview on lung cancer. It is the leading cause of cancer death that we know of, right? Both male and female.
Yes, that's correct. Lung cancer is a very significant disease, and the problem with lung cancer and the reason why it's the leading cause of cancer death is because there aren't symptoms until pretty late stage in the disease, making early detection critical. And so about 70% of newly diagnosed lung cancer patients are stage 3 and stage 4. And so that's really what makes it important to get the word out regarding lung cancer screening.
All right, so the biggest thing anywhere, but particularly West Virginia, is smoking. And of course, you've been here a few years, so you know a lot of smokers in West Virginia. I would imagine that is the biggest cause of cancer and other pulmonary issues.
Yep, that's absolutely correct, Kyle. West Virginia has the single highest smoking rate in the country, and not surprisingly, it has some of the highest rates of lung cancer and lung cancer death in the country. We see a lot of preventable cases of lung cancer, and if we screen patients early, we give them a chance to beat it. The problem, though, is that not enough folks are getting screened for lung cancer because they don't know that they qualify. So there's a lot that we need to do in this country to get this right. But here in West Virginia in particular, our new lung cancer rate is 49th out of 50 states. We're ahead of only Kentucky. Our smoking rate is the highest in the nation. Our 5-year survival rate is in the bottom quarter in this country. Our early detection rate of lung cancer is in the bottom half in this country. So we have a lot of progress to make right here in West Virginia.
Yeah, those are some grim statistics. So let's start with screening. If someone out there is listening and they have been a smoker, they are a smoker, and they have smoked for many years, screening, as you've said a couple of times, is crucial. So what's the first step there?
So I'm going to use an analogy to explain this, Kyle. My wife and I have this debate about unplugging the toaster after we use it. So I'll use the toaster and I'll leave it plugged in. My wife will walk past the toaster and unplug it. So she says that leaving the toaster plugged in increases the risk of house fires. I didn't believe her and asked, well, where do we draw the line? Like, what other appliances are we unplugging, right? So one day I looked it up, and there are about 3,000 house fires over the course of about 4 years from a toaster. So the truth is, under the right conditions, faulty wiring or other circumstances can cause a house fire from leaving a toaster plugged in. So the risk is reduced by unplugging it. So the connection here to lung cancer screening is that cigarette smoking creates the conditions that increase the risk of lung cancer. So the faulty wiring, so to speak. So cigarette smoking creates that faulty wiring, and lung cancer screening reduces your risk of dying from lung cancer. Quitting smoking is important. So quitting smoking is like fixing the faulty wiring, but getting lung cancer screening is like unplugging the toaster. It can actually save your life.
Mm-hmm. Now, again, there may be. I'm sorry. Did you finish your point? Go ahead.
I think it's just very important to say that lung cancer screening reduces lung cancer deaths by 20% in high-risk patients. So, and we figured this out over 10 years ago. But despite this, our rates of lung cancer screening are very low. Nationally, only 13% of eligible patients have been screened, and this is very low. And the adherence rate is 22%, meaning that every year you can get a follow-up screening study because it is an annual study, and only 22% of patients who are eligible for follow-up screening actually return for another study.
Okay. One point real quick, there may be somebody out there listening saying, you guys talk about stop smoking. It's not that easy. I mean, I understand it's a very difficult habit to break. So what about smoking cessation? Are there ways to help people drop the cigarettes forever?
Yeah, that is an excellent point, Kyle. Cigarettes are designed by really, really smart people in labs to be as addictive as possible. And so one of the first things that I tell folks who smoke is that it's not their fault that it's so hard to quit, but that making an attempt to quit smoking is worth it because it reduces your chances of lung cancer, but it also improves your quality of life from a breathing standpoint. It reduces your risk of infections, and it generally clears up a lot of chronic bronchitis. So we like using a combination of the different things to help folks quit. You can call 1-800-QUIT-NOW, which is the Smokers Quit line. You can talk to your provider about nicotine replacement or pharmacological agents that will help you quit smoking. All of these things work. Also, talking to friends and family, particularly other smokers, and making a verbal commitment or being a part of a community that's trying to quit, or tying it to a relationship with someone else who's trying to quit is also a great tool. And sometimes it's a combination of all of these things that get folks across the finish line. It's not important that you get there all at once. I tell patients all the time, you don't need a home run. You just need a ground ball single. You just need to make an effort, and you need those sort of attempts to accumulate to kind of get you across the plate.
My next question is, what are some other causes of lung cancer? I think we've probably all heard the story of someone who's never smoked a cigarette in their life, but they still come down with lung cancer. So what about some other environmental causes for lung cancer?
Yeah, that's a great question, sir. There are other environmental causes, particularly here in West Virginia, where, you worry about radon exposure, which is why, screening for radon when you buy a new home is just sort of part of the process. You worry about family history of lung cancer, occupational exposures. There are occupational exposures here in West Virginia that increase the risk of lung cancer, but those are things but 90% of lung cancer is caused by cigarette smoking. And so there is an increased risk of adenocarcinoma in non-smokers. We just don't have a great tool for screening those folks. Interestingly, lung cancer screening has been available since 2015, and before 2015, there was no way to screen for lung cancer deaths, which is amazing when you think about it. We've only had this tool for about 10 years. But in truth, we're still introducing lung cancer screening. It's not really on our radar yet nationally, which means that every month we're losing folks in our lives whose lives could have been saved with lung cancer screening. And so I think that if you have a family history of lung cancer, or if you've worked in an environment where there's a higher risk of exposure to carcinogens, that's an important consideration in non-smokers. And radon exposure is also an important consideration in non-smokers.
Right. Well, we're going to get into the screening process in just a minute. We need to take a really, really quick break. We are with Dr. Peter Cochipura with Mon Health Systems. This is Mon Health Talk. We're going to take a quick break here, and we're going to get into the low-dose CT and LDCT screening. And we'll do that when we return. Stay with us. Mon Health Talk for this Monday continues after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk continuing for this Monday. Our guest, Dr. Peter Cochipura, and he's a pulmonary care specialist with the Mon Health System. So, doctor, let's get into the screening. You talked a lot about it in the first segment. Tell us about low-dose CT or LDCT screening and why it's so important.
Thanks, Kyle. So the important thing to know is that lung cancer screening can significantly impact the lives of friends and family members by detecting lung cancer early. The things that you need to know in terms of qualifying for lung cancer screening is that the criteria are if you're between ages of 50 and 80 years of age, if you smoke currently, or if you quit within the last 15 years, and if you've smoked for 20 pack years, for example, 1 pack a day for 20 years or more. So if you're older than 50 and you've smoked for 20, for a pack a day for 20 years or more, don't wait for symptoms. Ask your primary care provider about getting screened.
Yeah, you said earlier when you start to feel the symptoms, it's a lot of times too late, right? So first of all, what are the symptoms are we talking about?
So for most folks, we don't have pain fibers, we don't have sensory fibers in our lungs, so we don't feel changes in our lungs, and this is what makes diagnosing lung cancer so challenging. So you can have a nodule or even, 3-centimeter mass, or you can even just have pneumonia and not really feel that process happening because there are no pain fibers, there's no sensory fibers. So the common symptoms that folks will present with is unexplained weight loss, a cough, particularly coughing up blood, hoarseness, a vague chest discomfort, or just a shortness of breath, a cough that won't go away. So those are generally the things that we look for. But for a lot of smokers or ex-smokers, you may feel fine. You may not have any of those symptoms, which is why we advocate for a once-a-year low-dose CT screening.
Okay, and you described the screening, and it couldn't be any more simple. It's 10 minutes. There's no prep time or recovery time. So you literally walk in to the facility, get the screening, walk out, go about your life, right?
Yes, absolutely. It really is a very, very simple process. There's no needle, there's no IV, there's no dye. You don't need any labs beforehand, and it's a very, very quick scan. And here at Mon Health, we schedule it around the availability of the patient, and so we make it very, very straightforward to come in when it's convenient for you to get this scheduled, and just for you to go on with your day. And it's once a year, and so those 10 minutes once a year is as straightforward as it could be.
All right, so no needles, no invasive procedures. What exactly happens during a scan?
So you lay on a table, and the table rolls into this big donut and then rolls back out. So if you've ever had a CT scan, it really is it's not like an MRI where you go into a tunnel and you stay there for 30 minutes. You just lay on a table, they roll you into the donut, and they roll you back out.
So what happens if the scan turns something up?
So it's interesting. Most findings on low-dose CT are not cancer. The cancer detection rate is somewhere around 2%. So what I tell folks in the office is that if you think of a chest X-ray as one page in a book, a CT scan is the whole book. So when we do a CT scan, we get a lot of information. But most low-dose CT screening studies are negative for lung cancer. We don't find cancer. But we know that we have to screen around 330 folks or so in order to find one case of lung cancer. Now, if you screen a population of really high-risk folks, that number is lower. You may need to screen only 200 folks. And if you screen a very low-risk population, that number is much higher. But on average, if we scan around 330 folks with a history of tobacco use, we'll find a case of lung cancer. So if we find something abnormal, most of the time it's really not lung cancer. It's just something that needs to be followed up on with your provider.
Okay, so again, those qualifications between 50 and 80, if you smoke currently or you've quit within the last 15 years, and if you have a 20-pack year history, 1 pack per day for 20 years or more. So what if someone smoked as a youth? They smoked through high school, they smoked through college, they smoked as a young adult, but they stopped, and they've gone past the 50-year mark. What are again, every case is different, but are those people still at risk?
So the risk of lung cancer 15 years after quitting is significantly lower. And so at that point, we feel that the benefits of the test are not great enough to exceed the risk of doing the study. So we want to minimize radiation dose, which is why it's a low-dose CT scan. And that's what the low means, is that we use the minimum amount of radiation. We don't use the radiation that we use for standard CT scan. But at 15 years out, your risk of lung cancer, having quit for that long, is low enough that we don't think that you have a benefit from doing the screening study. Mm-hmm. Does that make sense?
Yeah, absolutely. And again, you keep repeating it. The most important thing is early stage lung cancer. You can get through it, right, if you catch it in time.
Yes. The survival rate for early detection of lung cancer between 70 and 90%, which is amazing when you think about it. This was something that we couldn't talk about 20 years ago. The survival rate for late-stage lung cancer is less than 15%, which is why the difference in those two numbers are so big that we really push lung cancer screening, just because we want to find it early when the survival rate is really, really high, as opposed to when it's found late and the survival rate is lower.
Okay. All right. So if someone is listening and they fit this criteria, or a loved one fits this criteria, what are the next steps? What should they do if they're interested in the screening?
Well, the important thing to remember, Kyle, is that any provider can order a low-dose CT scan. Because it's a screening study, we want to make this as easy as possible so that folks get screened, so that we find cases that where they can be fixed with surgery. And then they can go on with their lives. So your primary care provider can order low-dose CT. Your cardiologist. I have Dr. Holhouse, who's an OBGYN in Preston County. He orders low-dose CT screenings for his patients because he's committed to saving lives from lung cancer, even though he doesn't treat lung disease at all. It's a screening tool. So we want all providers to be able to use it. So if you think that you qualify, ask your provider about it. You can always reach out to us at Mon with questions. The important message that I have, though, for non-smokers is that we all know at least 3 smokers are non-smokers or ex-smokers. Don't be afraid to talk to them about it because, over the years that I've been doing this, one thing is consistently true. Nobody wants to die of lung cancer. Every patient I've ever cared for with a scary nodule on CT scan has said, I hope it's not cancer. And if it turned out that it was, the next question they asked was, how can I beat this? It doesn't matter if they smoked or they quit or they never smoked. No one wants to die of lung cancer. So if you're out there and you can think of 3 smokers or ex-smokers in your life, don't be afraid to ask them, do you know about lung cancer screening? Because that simple question can save their lives. And here in West Virginia, we just don't ask that question enough. And then ask those 3 friends to talk to 3 of their friends. That's how we, as a community, improve lung cancer screening and beat lung cancer.
Yeah, that says it all. I mean, that sums it up perfectly. Great job there of just kind of again summing things up. And again, you can learn more. Go to monhealth.com/LDCT. You can learn more about the screening or talk to your primary care physician. Dr. Peter Kochopura has been with us. Again, doctor, great information. We appreciate your time, and thanks for getting the word out.
Absolutely. Thank you so much for having me, Kyle.
That is Mon Health Talk for this Monday. Thanks for listening here on WAJR.